you didn't move from your seat, like I always say, if you move from your seat, by the time you're coming back, you miss something really amazing. Well, it's very normal if you want to get a glass of water or a glass of juice, because, you know, we are the bringers nation. And when it's really hot on the show, we need something to calm down our temperature and to calm down the heat within us, right? And this is the Bring It On show on CMTV. And our question for this show is, how often should someone get a medical checkup? How often should an individual get a medical checkup? And why do you think someone should get a medical checkup that often? And our contact is on the screen. It is 678-02-8885. 678-02-8885. And on this edition, we have a wonderful guest with us today, who is sharing with us wonderful insights on how to handle our health and how to go about when we come across some certain health scenarios or disadvantages in our lives. So, like I said, our question is on the screen. How often should an individual get a medical checkup? Viewers, I am all ears. I'm waiting. So, we'll be going to our guest, because our guest, you actually made mention of cancer. And you said there are different types of cancer. Now, you also made mention of you guys carrying out a campaign. Are you guys carrying a campaign on all types of cancers, or on a specific type of cancer at the moment?
Well, our association is based on all the type of cancers.
Yeah.
But, you know, for you to be able to accomplish something, you must go on a step-by-step basis.
Yeah.
So we work basically targeting the one cancer at a time.
All right.
Yes, that's why we are here today, to talk about liver cancer.
Okay.
Yes, and as KOCAN, we believe that in that way we'll be able to help the public, just to be able to create awareness, and then give them the information that they are maybe reluctant to get, because information is everywhere. But just by watching the TV, you get information and you get saved.
All right. So, if I actually have to go forward to ask, what is liver cancer?
Cancer, as I initially defined it, is just an abnormal group of the abnormal uncontrolled proliferation of cells.
Yeah.
Now, when it gets narrowed down now to liver cancer, it's just the abnormal proliferation of liver cells, which are termed hepatocytes.
Okay.
Yes. So that is liver cancer.
All right. So now getting into this, I want to ask, are there specific signs and warnings that someone can get, or you just sit one day and go for a diagnosis and you're told, you've never had a headache, you've never had fever, you've never had anything, you just go for a diagnosis and the doctor is like, you have liver cancer. Like, seriously, I have liver cancer. It's going to be really heartbreaking, but if people actually can get the signs and warnings, maybe that would be easier. Are there really signs and warnings to this?
Well, liver cancer rarely presents with signs and symptoms. I'm talking about the main liver cancer, which we term in our medical jargons hepatocellular carcinoma.
Okay.
At the early stage, it doesn't present with signs and symptoms.
Okay.
That's why we term it asymptomatic.
Okay.
Yes. Then, when you now go to the late stages, the kind of signs and symptoms that you can have. You can have weight loss.
Okay.
You can have fatigue. You can have weakness.
Okay.
You can have loss of appetite.
All right.
Nausea, vomiting. You can also have, there is what we call jaundice, which is just yellow discoloration of your skin.
Okay.
Your skin becomes yellowish, your eyes become yellowish.
All right.
Yes, and even some parts of your skin, like your mouth, your tongue, they become yellowish because of the abnormal functioning of your liver.
All right. We also have this other question, which is, are there things that cause this liver cancer? Because we understand that if you're actually going to have a disease, then most of the times with the diseases that we have are caused by something. Maybe by a particular lifestyle, or maybe by something you touched, or something you ate, or something you did. So now, does liver cancer just generate from nowhere, or does it actually have something which we do which causes it?
Now, liver cancer can be of primary cause, which will involve the liver cells itself, primarily. That is, it originates primarily from the liver.
Without any problem?
No. That's, I'm just trying to explain why the different causes, right?
Right.
I'll narrow it down when I get there.
Yeah.
Now, liver cancer it can be primary, that's with respect to it originates directly from the liver, and it can be secondary when it's as a result of spread from another organ, Like, for instance, lung cancer. Lung cancer can spread to liver cancer.
Okay.
Yes. So now, the primary cause of liver cancer, when you are talking about the primary liver cancer, what are the causes? You can have, first of all, the first cause, which is a major cause, what really causes the abnormal proliferation of cells, is what we term as a mutation. You can have a mutation at the level of your DNA. Now, what is the DNA? The DNA is just an information, is an instructor of the chemicals reactions that occur in the body. So when there is a disruption of that DNA, it now begins to function abnormally. Now, when it begins to function abnormally, the cells it now affects the rate at which cells grow and the way that they grow. Now, that can lead to cancer. Now, what can predispose this? You can have radiation, radiation that is ionizing radiation, like we have X-rays. X-rays. Yeah. You can have sunlight, ultraviolet rays, and we can also have the major cause, which is most often related, correlated with liver cancer, is chronic infection of hepatitis B virus and C.
So that is it can come as a result of hepatitis B and C.
Yes, the chronic infection. When I say the chronic infection, is a long-lasting infection.
Like the last stages, the crucial stages of hepatitis B and C.
Not really the crucial stages.
Yeah.
I'm talking about an infection that has lasted for over 6 months without treatment. When you allow the infection to last for that long, it destroys your liver cells slowly, and it can lead to a cancer.
All right.
That is one. Then you also have what we call liver cirrhosis. Liver cirrhosis is liver scarring, progressive liver scarring, which is not reversible. What can cause liver cirrhosis? Excessive consumption of alcohol.
Okay.
Most often, what kills us is our mouth. What we take in is most often what kills us. So if you consume too much or excessive alcohol, you are at risk. You are giving yourself liver cancer. Why? Because that alcohol is going to pass through the liver. The liver is like the detoxifying agent. It's like the Ezakam, as I can put it, of the body.
Okay.
Yes. So it clears out all the dirty things in your body. And alcohol in excess is not good. It can become toxic. And it can lead to liver scarring. That's what we call liver cirrhosis.
Okay.
Yes. Another cause is hepatitis C, like I mentioned before, which has the same pattern. Yeah. Hepatitis C virus chronic infection. Another cause can be as a result of genetic diseases, inherited diseases, like what we call hemochromatosis, which is iron overload. If you have excessive iron in your system, it can lead to liver cancer. Okay. Yes. And I think those are the major causes of liver cancer. Okay. The major ones.
All right. So viewers, we actually had a lot. I'm thrilled. You know, this knowledge is really amazing, because most of the times we can neglect these things and think that they are not important, but it is important for us to know these necessary things, because they guide us and guard us as we live our day-to-day life. Of course, you can't actually carry out a daily activity. You can't go to your business place. You can't go to your job site if you are not healthy. So Mr. Ezikiel from KOCAN Africa is here to educate us, and he is educating us. And it is just getting started. And we've actually had contributions which are coming in. But we're actually going to take one more question for our guests before we get into the contribution. And we have this question. The question I have for you, Mr. Ezikiel, is there a specific age range where someone can actually have liver cancer?
Well, if the question comes up, we're going to talk about the risk factors. Okay. And age is one of the risk factors. Okay. Age is one of the risk factors. When the older you get, normally, the more at risk you are to certain diseases. Yeah. And cancer is one of them. Okay. Cancer is directly associated with age, depending too on the type of cancer. All right. In this case, liver cancer, when your age predisposes you. The older you get, the more you are at risk of getting the liver cancer. Okay. And also, we can also talk about the gender. Okay. Men who, as we know, most at times men consume more alcohol than women. Yes, so men are more predisposed to having liver cancer than women.
Okay.
Yes.
Wow, that's really amazing. Thank you so much for that insight.
Okay.
I'm actually being, like I said, I'm thrilled. I'm full. I feel like my brain is stocked up right now because the wisdom I'm getting from him or the knowledge I'm getting from him is making me feel like, oh, have I actually done this? Now, we have this contribution which says, hello to you at the studio. It is indeed sad when the world loses an icon. Yes, it really is. Thank you so much for joining us. It really is sad when we have the world loses an icon. And this person says, my response to the question is at least twice in 3 months because it is important for us to be sure of what we carry. This person says, hello to you at the studio. It is indeed sad when the world loses an icon. My response to the question is at least twice in 3 months because it is important for us to be sure of what we carry. Thank you so much. You still not told us who you are. Please tell us who you are and where you're writing from because I or the team at CMTV wants to celebrate you. We celebrate people. All right, this is the end of the month. So we are happy we made it to the end of the month. Or aren't you happy? I am happy, so we want to know who you are. Okay, please send in your name and tell us where you're writing from. And now back to you, Mr. Ezikiel. We have this contributor who says, to him or to her, he or she believes that we should all go for medical checkup like 2 or 3 times, like twice in a month, twice in 3 months. And because he believes or she believes that it is important for us to be sure of what we carry. What do you think about this?
Well, first of all, I think that for you to be the number of times that you go for medical checkup will depend on, first of all, your health.
Okay.
Your health. It depends on if you have a chronic disease, it will require that you go for medical checkup as often as your physician instructs you to.
Okay.
Now, if as a normal, healthy human being, it is advisable that with respect to your age, people who are less than the age of 50 years should at least go for medical checkup once every 3 years.
Okay.
Is that okay? And those who are above 50 years should find themselves in the hospital for medical checkup for at least once every year.
All right.
Yes.
We also have this contribution which is coming in and it's in the form of a question.
Okay.
The viewer says, do phones really cause cancer? Leslie from Limbe. Thank you so much, Mr. Leslie from Limbe, for joining us on the program. Indeed, we have to be educated and enlightened about the things around us, right? So Mr. Leslie is asking, do phones really cause cancer?
Well, Mr. Leslie, I would say that yes. Yes. There is a type of cancer that we call squamous cell carcinoma.
All right, so
which is of the skin, cancer of the skin.
Okay.
We can put it that way.
Okay.
Yes, and the phone that we use, they emit some rays that I can call, those rays can cause mutations, just like the rays that we talked about, the ionizing radiations. But they are far less mutation causing.
Okay.
But in a long run, they can pose a problem.
Okay.
Yes, that's why it is advised that, especially when your phone is on charge, you stay away from your phone when it's on charge.
Okay.
Yes, when it's on charge, and also always try as much as possible to use your earphones when you're answering your calls. Don't put your phone in your pocket.
All right.
When you are, especially for meals, when you are maybe walking or doing something, your phone should always have somewhere out away from your skin.
All right.
Yes.
So this is really amazing. Thank you so much for that insight. I'm sure Mr. Leslie from Limbe has had an insight on what to do with his phone when it's around him. Phones are not bad. They are meant to help us communicate because it helps us to bridge the gap between us and our loved ones and our friends and to better pass on information within our community easily without moving from one place to the other, right? And we also have this other contributor who says, good evening, beautiful. Thank you so much for calling me that. Indeed, I am. Thank you so much. He says, good evening, beautiful. Good evening to you too. I am Collins from Bumaka. Thank you, Mr. Collins from Bumaka, for joining us on the program. It's really awesome having you. And he says, I think one should go for a medical checkup every month because we are liable to diseases and infections always. He says, I take again, I think one should go for a medical checkup every month because we are liable to diseases and infections always. Thank you so much, Mr. Collins from Bomaka, for joining us on the program. And indeed, I love your contribution. But as we always say, our guest has the final say. So, our guest, what do you also think about this, Mr. Ezikiel? What do you think about this?
Well, going for medical checkup once every month, yes, it's good. Sounds very captivating to the ears. But what about the financial expenses?
Okay.
Who covers them every month? Who is going to take care of the test that you are going to order? Because when you say you are going for a checkup, they are actually going to, it's a routine checkup.
Okay.
Yes, and you have to spend some money. But nonetheless,
yeah,
it could be good.
Okay.
To go every month. But like I said before, it depends on what you are suffering from.
All right.
What
if someone is not suffering from anything? Like they always say that it's important that you know your state. So you don't just sit and you're surprised. Because we always hear of someone has just sat and collapsed because the person was actually short of blood or something. But the person was actually really healthy. The person didn't actually look sick. But you want to say the person just fainted, or at some point we actually had cases where people have died as a result of they've had an illness within them, but since it didn't show signs on the outer part, they didn't actually see any reason why to go to the hospital for checkup often. So don't you think that it is important for them to do this checkup whether they are sick, whether we are sick or not?
Yes, I don't argue that.
Okay.
But how often?
Okay.
Is a question.
All right.
How often do you have to go for checkup? When I say once every 3 years,
yeah,
it again goes back to how you feel. If you feel well, it's good that you go in once every 3 years. But there are other diseases. The reason why we go for medical checkup is just to know that maybe there's something, there is something going on, like we talked about liver cancer that is asymptomatic. It could be going on and you don't know about it.
Yeah.
Yes. So if you think it wise, if you have the financial backing,
yeah,
you can go once a year.
Okay.
Nobody is refusing you that.
Okay.
Nobody is refusing you that.
All right, that's really amazing. And I also have this question which I want to ask. You made mention of the signs and symptoms of liver cancer. Now, I wanted to ask, does it spread? Like, because we always know of that there's cancer that spreads. Now, does liver cancer spread to other parts of the body?
Yes. Most cancers have the property. It's called metastasis.
Okay.
This is one of the most defining characteristics of cancer.
Okay.
Yes. They are able to leave from their region or from their tissue of origin, their organ of origin, and then their cells can penetrate and enter blood vessels. How do they spread? They spread either through a blood vessel or a lymphatic vessel.
Okay.
What are blood vessels? They are just tubes, in a layman's sense, that carry blood from our heart to the surrounding tissues.
Okay.
And what are lymph vessels? They act like filters.
All right.
They filter our blood and then carry the excess fluid back to back to the veins. That is what some of the blood vessels. Well, veins are. There are two types of blood vessels.
Yeah.
You have the vein and the arteries. Okay. So the lymphatic vessels carry that filtered blood, the filtrate of the blood, back into the veins and then back to the heart. So the circulation continues. That is how liver cancer can spread.
Okay.
It can spread to other tissues like the lungs. It can spread to the bones, and it can also spread sometimes to the brain.
All right. So we actually have another contribution which is coming in. Viewers, I'm actually enjoying you guys today. I think this question, I should be bringing questions like this for you guys because it actually makes you to realize that we all need to take care of ourselves. We are the bringers of change in our community. And if you want to bring change, it's not all about the finances. We also have to make sure that we change our attitude towards our health, towards health activities in our community. And we also have this contribution which is coming in, and I'm really loving it. It says, good evening to you in the studio. I really love this program. Thank you so much. Thank you so much. And this person says, to me, I think 3 times a month. Wow. I want to ask if a pregnant woman with hepatitis C positive gives birth to a baby who is not infected with hepatitis. Okay, this person says, I want to ask if it's possible for a pregnant woman with hepatitis C positive to give birth to a baby who is not infected with hepatitis? Morgan from Moliko. Thank you so much, Morgan from Moliko, for writing us on the program. It's really amazing. And thank you for joining us today, because we have someone who can actually give us the answer to this question. We always have it, right? So, Mr. Ezikiel, we have this lady. She's asking if it's possible for a lady who is positive with hepatitis C, with hepatitis C positive rather, if it's possible for that lady to give birth to a baby who is not infected.
Well, that will be if the birth is really controlled.
Okay.
If it's controlled, but it will be, the chances to me, based on my knowledge, will be slim, because with a baby, there is that during birth. During birth, there is that cross of blood from the mother to the child. Yes, and if care is not taken, the baby is going to be positive.
Okay.
Yes, if care is not taken, the baby can be positive.
Oh wow, that's really, really amazing. So Miss Morgan from Moliko, I'm sure you actually had an insight on what to do, right? So it's just for you to be careful, or your doctors to be careful during delivery, or the person in question you're asking for should be careful during delivery. Now, I also have one question for our guest, and I think you also love this. Now, because in respect to what Miss Morgan is asking, or Mr. Morgan, I would say, is asking, the person is asking if it's possible for a pregnant lady not to infect the baby during the pregnancy or after the pregnancy. Now, is there a particular way in which it can be controlled during pregnancy? Sorry. So even during childbirth, the chances there do not actually mar the child's health?
Well, I would say that, first of all, hepatitis C or hepatitis B can be treated.
Okay.
It can be treated. So the first thing I would advise to a pregnant woman who is positive is that the person should seek the medical attention of a doctor, seek a medical attention.
Okay.
And yes, and from there she's going to get more information on maybe the possible ways that it can avert the possibility of her giving the daughter hepatitis C or any of the hepatitis virus.
Okay.
Yes, and to me, I think that it is always possible to treat. It's better to treat.
Yeah.
And keep yourself away from trouble.
Okay.
Yes. So I would advise her to, if she's pregnant, to see a doctor, and if she's hepatitis C positive, to get herself treated.
Okay, so that's really amazing. Now, we've actually gotten this, Miss Morgan, because I actually had to add in that question for your sake. Well, not just for your sake, but for us all, the bringers of change in our community, because we all pass this knowledge to someone else we meet who might still be in dire need of it, right? So we have this other question. We were talking about liver cancer. We are all about liver cancer today, and the awareness which KOCAN Africa is creating in our society and the world at large about liver cancer. Now, I have this question for our guests. We understand that cancer as a whole, you can actually, every disease actually has a treatment, definitely. So liver cancer, does it actually have a cure?
Liver cancer can't really, the cure of cancer now is very, very slim.
Okay.
There's always that chance of remission. That means there's always that chance of recurrence.
Okay.
Yes. So, but for somebody, depending on your stage, for somebody who has early prognosis, the chance that you survive of 5 years is at about, it should be at about 30-something percent, 33% or so for 5 years. And the chances for somebody who is at a late stage to survive is about 11% after 5 years.
All right.
Yes.
So that's it. And now, if that's the chances of getting it, I know we always hear of chemotherapy. When we have cancer, you can go for chemotherapy, and there are people who actually had a breakthrough from that. So if you actually have this liver cancer, will you actually have to go through chemotherapy the same as every other person who has cancer?
Well, Chemotherapy is just one way of treating cancer.
Okay.
Yes. There's also radiotherapy.
Okay.
There is surgery.
All right.
There is surgery that they can do surgery to remove the tumor.
Okay.
That is in your liver. There's also surgery that they can do. It is a transplant. They do liver transplant.
Okay.
If you have a donor, they can replace your liver that is cancerous with a liver that is not cancerous.
Okay.
And if it matches with your system, you can live with that.
So we have this this contribution which is coming in, and it says, this person says, for me, I think people should watch their health and equally get a little education on the issues, on the issues health, so that the doctors can rest. So this person is saying, for me, I think people should watch their health and equally get a little education on health issues so that the doctors can rest. That is what our viewer is saying. And it's Leslie from Limbe. So Leslie from Limbe is actually intrigued by the show of today. Thank you so much, Leslie from Limbe. And don't move from your seat, because I'm actually having fun with these contributions you're sending in. It's really amazing. So he's saying that for him, he thinks that people should watch their health and equally get a little education on health issues so that the doctors too can rest. So he is on the side that doctors need to rest. People actually balk doctors somehow. Do you actually think that we should only go to the doctors when we feel like we've not been educated?
Well, not really.
Okay.
Not really. The issue we have a problem in Cameroon and in middle income countries.
Okay.
We are we are not concerned. We are not concerned with our health.
Okay.
We don't bother too much about our health to find out. There are some little things that you should know about yourself as a human being. Yes, as a human being, so that you can watch your health, watch your weight, and maybe just what you eat alone. Just what you eat alone is poison. You can be eating poison that is just killing you slowly without you knowing.
Okay.
So it's always good to be informed about health, but about the fact that you are allowing doctors to rest. No, I don't think. If you have the knowledge, you get to the doctor. It's inside clear. You can communicate better with your physician when you have that base knowledge. Yes, that it will be easier. It will be much more easier for your physician to communicate to you when you have a base knowledge about your health and about the topic concerned.
All right. So we're also taking this other contribution, and the viewer says, good evening. I'm really enjoying this program. Or I am too. Well, I wish I was watching from my house, but I'm still enjoying the program. So this person says, I think everyone should go for checkup once every month. Doctor, how can one treat gonorrhea using home remedies? Joy from Boya. Thank you so much, Joy from Boya, for joining us on the program. It's really amazing having you join us on the program. And indeed, I guess we'll give you an answer to this question. And it reads thus, I'm really enjoying the program. I think everyone should go for checkup once every month. Doctor, how can one treat gonorrhea using home remedies?
First of all, I want to make a correction.
Yeah?
I'm not a doctor.
Okay.
I am not a doctor. I still have 3 solid years to go. If my teacher or one of my lecturers, one of my professors hears that, I don't think one student was almost sanctioned for allowing himself to write second 7-year medical doctor. I'm not a doctor. And about your question on how to treat gonorrhea with home remedies, I'm sorry, if you think you have gonorrhea, I don't know who diagnosed it.
Okay.
It's just a thought.
Yeah.
Until it is medically diagnosed that you have gonorrhea, then you can start talking about treatment.
Okay.
Yes. And if you feel you have symptoms, because there are so many things on the internet now, if you feel you have symptoms of gonorrhea, I would advise that you go and see a medical doctor.
Okay. Please.
Self-treatment at times is much more harmful and costly than going to the hospital.
Exactly.
We should learn to go to the hospital, go and complain and do the necessary checks. You can even go to the hospital and request for a gonorrhea test that is going to be done for you.
All right.
It's by your request. So I cannot tell you anything about home remedies. I'm sorry. I would really advise that you see a medical doctor. Thank you.
Okay, that's really amazing. Now, Miss Joy, I'm sure you had an insight. Please go to the hospital. Don't make any concoctions. Don't mix anything and drink because you might just cause harm to yourself. So go to the hospital. And now we have this question for you. In respect to liver cancer,
yes.
Now, when it comes to gender, you know, there are some diseases that might actually lay more on gender. You know, ladies would say that since their system is more weak and our system is more weak, or because I'm a lady too, please. Since our system is more weak and it's vulnerable to diseases, if we don't take care, we will find ourselves in terrible situations. So now, as a girl, shouldn't a lady be more concerned about getting checkups as often as possible?
With respect to liver cancer
Yeah.
and gender,
Yeah.
I think when a liver cancer has a higher incidence in males than in females. Yes.
Okay.
And with respect to if females to be more concerned or whatsoever, you just need to watch your lifestyle.
Okay.
Yes. Most at times, if you watch your lifestyle, like I said before, the excessive consumption of alcohol. As a lady, you should consume, if you want to consume averagely, if you must drink, 1 bottle of drink a day. Not per day, that is when during your regular, yes, yes, for persons who think they cannot go over a day without taking alcohol.
Yeah.
Yes, but if you are that kind of person who are always into alcohol as a lady, if you drink 2 bottles of alcohol as a lady, right, and a male drinks 2 bottles of alcohol, you have a higher risk of getting, as a result of that. If I'm just taking an example, let's take a higher example so that it should be more clearer. You take 4 bottles of alcohol as a lady, and a male of the same age, right, takes 4 bottles of alcohol. You are at more risk of getting liver cancer than the male with 4 bottles of alcohol.
Wow, that's really amazing. So ladies, please, let's be watchful. Don't go out and you think since you're going out to have fun with your friends, you're like, God, I must compare with you. I'll take the same bottles you're taking. Please, you might just be drinking yourself to your grave, or you might just be drinking yourself to an early grave. So please, let's watch what we take and let's watch what we consume, please. Because it is, like our guest said, it is important we learn about our body and we take note of what we put in, because what we put in will definitely be what will come out of us, right?
True.
So that's really amazing. And then, we are not yet done, because I have the other question for our guest. In respect to liver cancer, I know that you can actually get screening. Can you just get screened or go for your test in any hospital, or are there specific hospitals, be it in Boya or in the country, that actually does screening for liver cancer?
Well, for liver cancer in particular,
in
Boya, I think the regional hospital is able to do that, cover that expenses.
Okay.
That liver cancer, they can do liver cancer screening.
Yeah.
One of the liver cancer is not really as common as it seems in our own setting.
Yeah.
But it happens.
Yeah.
It happens. The most common is breast cancer, that they organize regular free screenings.
Yeah.
Which is sometimes done at Boya Regional Hospital.
Yeah.
You can also, there's Bingo Hospital, Bingo Baptist Hospital.
Yeah.
They have a cancer section.